and we've talked about the hips a little bit before, but just at some point, I'd love to examine it, but we want to twist it around, cross your leg, check the range of motion, the strength and the different muscles of the hip. But let's dive into your MRI because that's the meat and potatoes.
Are you going through life blind? This is Eyes Wide Open with Nick Thompson. On this podcast, we share knowledge and stories that build human connection while elevating stigmatized societal issues such as mental health, holistic wellness, culture, free speech, and more. All to ensure we show up in the world with our eyes wide open. Hello, everyone, and welcome to Eyes Wide Open. This is part 2 of my personal stem cell journey in an effort to repair and rejuvenate my left hip after an injury that I sustained a couple years ago. In last week's episode, which you'll find linked below, I sat down with anti-aging specialist, stem cell specialist, and neurological surgeon, Dr. Jeff Gross, to learn about stem cells, what they are, why they're important to support regenerative health, and started exploring whether or not it would be a good treatment option for this hip injury where I tore my labrum. If you don't know, the hip labrum is that ring of cartilage that lines up the hip socket and stabilizes the hip joint. If you're interested in the first part of this to learn a little bit more about my injury, but stem cells in general, I encourage you to check out episode 1 in the link below. This episode is a little more visual or cinematic, I'll say, as I take you through my experience going all the way out to Las Vegas for the procedure. But we'll start out here. If you want to be able to see Dr. Gross walk me through my hip MRI, which is a procedure that I had done in order to sort of kickstart this treatment. If you want to see Dr. Gross walk through the hip MRI with me and go through the complete procedure experience and post-op follow-up, check out this episode on YouTube. That link is also below. You'll get the full visual experience. Now, you might be asking why I decided to share my medical details, my hip injury, the procedure, and the whole follow-up. And I think it's because there's such a stigma and an ambiguity around alternative treatments in the medical field, which if you listen to the show, you probably know that's a general feeling that I have. And my original doctor that I had been going to for this injury said that my only real option is pain management and then an eventual hip replacement. And I started thinking to myself, like, okay, well, I'm not even 40 years old. I don't think a hip replacement is what's right for me. But Dr. Gross, as you'll see on last week's episode, Dr. Gross helped me understand stem cells and made me believe that this was going to be a procedure that was worth my investment to try something that is more regenerative and has medical backing and increasing amount of studies that indicate its success. And it would be a better place for me to start as opposed to starting at the hip replacement or pain management like cortisone shots or whatever those are. So I hope you enjoy this little bit of a more personal look at my hip and my experience going through this stem cell procedure, and follow along with me over the next few months as I will touch base on how I'm doing and if it's working. And in the meantime, let's get to it, and I hope you enjoy this special episode. Well, here we are a few weeks later, and I got my MRI, so we're going to actually review that live in real time. Well, I guess by the time you see this, it's actually recorded, but we're going to review it in real time for the first time of my left hip with Dr. Jeff, so take it away, and you should be able to share, I think, from the bottom.
I can, yeah. Before we do, let's just make sure that everyone understands you're sharing some private information, private health data information. You give me permission to talk about it and
yes.
Absolve me of all sins here.
Yes, you are absolved of all sins. I am willing to share the insides of my left hip socket with the world.
Great. And because we just don't go on MRIs alone, can we do a quick rundown of your hip symptoms?
Yeah.
Okay. Good. Okay. So you told me last time that you've got some left hip pain, and sometimes it can radiate in towards the groin and along the glute. If you were to say the epicenter where that stems from in your hip, where would that be? What part of your hip is?
So it moves around, which is the weird part. Like, for example, yesterday it was all in like the bottom part of my glute, and it kind of felt like every step I took, something in there was pinching. And then there's other times, including this morning, when it was all in my groin. When I first woke up this morning, it was all in the groin. And it was like that pinching. But it moves around depending on the day. And then some days it doesn't bother me at all. Like right now, it's not bothering me at all. Like I can't even tell that there's an issue. And then there are some days that I haven't had these in a while, but some days where it feels like my whole hip is just going to like fall out, which is the weird one. I'm like, is this the last step I'm going to take before it happens? Kind of how it feels.
All right. Well, and we've talked about the hips a little bit before, but just, at some point I'd love to examine it, but we want to, twist it around, cross your leg, check the range of motion, the strength and the different muscles of the hip. But let's dive into your MRI because that's the meat and potatoes of today's talk. So I'm going to try to share now.
And before we do that really quickly, did I tell you last time? I don't remember. It's been a couple of weeks. Did I tell you how I heard it?
We had talked about it, but I didn't take notes on everything.
We were just chatting then. And as a reminder, if I did, and if not, I was jogging outside a few years ago and it was slightly damp out. It was a fall day. It was around this time of year. I slipped on a wet leaf that was covering dog shit. And I caught myself on my left leg while my right leg was like heading into the air. And I just came down on it. And I don't know if it was really a pop per se, but I just felt instantly something was wrong and something had happened. So that was the OG injury.
Okay. And how long ago did you say that was?
It was around October 2022. So it's been about 2 years.
Okay. And what have you tried for the hip since then?
So initially I went to a doctor here in Chicago. I had an MRI. There was damage to the labrum, and the options were I could try a cortisone shot and physical therapy, because at this point it was hard for me to really do physical therapy. It hurt pretty consistently. Or I could go for option 2, which was labrum repair surgery. Given the time of healing and the rehab with the surgery, I opted to get a cortisone shot and do physical therapy. So I did physical therapy and I did some chiropractic as well. And I did that probably for about 6 months consistently. And it got to a point where it was manageable and bearable. And then over time, it just kind of started picking up again and was pretty painful. And so I went again back in April of this year, which I think you saw those results too. I went back in April of this year, and again, it had deteriorated according to my doctor a little bit more, and at this point didn't think a repair was possible or practical. So he said, at this point, I think we manage pain and continue doing exercises for it until you get a full hip replacement, which is not, to me, I'm 39 years old. I didn't want to go that route. So I did get another cortisone shot. And I continue to do physical therapy type exercises on my own pretty regularly. Okay. But it's kind of started trickling back up again to be pretty painful.
Okay. Let's see if I can share. And it's only giving me out here. Let's try entire screen. Here it is. Okay. I'm now an expert sharer. So you can see the screen?
Yes. And can you really quickly explain the difference? Because this was a different type of MRI that you had me get this time.
Yes.
Versus the traditional.
So I wouldn't necessarily say traditional. I would call it what you had was sort of just a run-of-the-mill average MRI, and how it's ordered and what different images and views, and we call them sequences, but they're different parameters on the machine. They change some knobs and it brings out some different information on the scan. So it's like playing with your camera on your smartphone. You can bring out different lights and hues and filters later and all that. Anyway, so you can see this is the left hip MRI. It says at the top, and now here everyone knows your birthday, so expect a lot of birthday cards. But this is you, and I pulled up 2 images already. On the left is a generalized widescreen view where they're looking at both hips. And you can see this is one hip, this is the other hip, and this is you looking at us and us looking at you. So this is your right hip on the left of the picture and vice versa. So I wanted to put this up first because when you look at the hip, it's a ball and socket joint. ball and socket, and the cartilage is in part in between those surfaces, and you can kind of see the left hip has a little bit of a thinning of that cartilage compared to the right. You kind of have to eyeball it from this image.
I could tell when you first pulled it up, actually.
Okay. But you can also see something that I don't know that we saw previously, but the socket bone, which is the doctor's term is acetabulum, has these kind of white areas and irregular dark and white areas on the left. On the right, it's rather a little bit more uniform gray. So there's something going on here in the bone marrow of the socket. Okay. Mm. And when you look close at it using a special sequence I ordered called STIR, if you see right here, it says core STIR. That's coronal STIR. And STIR is not always a typical inclusion in an average MRI. Okay. This brings out errant changes, kind of inflammation in the bone marrow. And if you remember from our earlier conversation, the disease of cartilage degeneration is it's from the bone. The bone cells make the cartilage. And if those cells aren't functioning, then the cartilage won't be healthy. So now you can see your left hip close up and even more detailed irregularities in that bone marrow of the socket. The ball doesn't look too bad, but the socket has all these funny bone marrow changes and a very ratty looking cartilage surface. So this is good old-fashioned loss of cartilage, thinning of the cartilage. Mm-hmm. In fact, right here, there's barely any of this, and this is called the labral cartilage, the labrum, which is sort of the gasket, the saran wrap that sits on the ball in the socket. And it's very thin here. And some doctors, if you saw this only on an X-ray, they would say it's just bone on bone.
Right.
Now, is there something in there? Yeah, there's something in there, but it's a very high grade cartilage degeneration, the highest being the lack of cartilage. The cartilage is gone. So that is one view. That's a front view of the hip. And you can see I'm very concerned about the bone marrow here. So why is this cartilage? Go ahead.
So that's not cartilage. I thought those were like the pieces of cartilage that were torn. That's actually bone marrow.
There probably are some small tears in the cartilage. It's hard to see when you have very little cartilage, but this is the bone marrow. If I could, all this is the socket of the bone, and I'm scrolling front to back here, and you have these issues front and back along that surface.
So now, are those from the initial injury, you think?
Possibly.
Or are they... Okay.
Possibly. I mean, there's something going on in here that set forth a cascade of events that this cartilage cannot maintain itself anymore. So, and then here's a cross section. Here's the ball. Let me improve the gray and white. So here's the ball, but you can see the socket has this bright inflammatory signal, and it's inflammation in the bone marrow here is a cranky sign. Okay, so it's my belief that your symptoms, which can be in different places, come from this socket and the wearing down of the cartilage related to the socket. Then here's a side view of the same thing.
And that's what you think is causing the bone marrow and the inflammation?
I think the bone marrow cannot produce cartilage to maintain and restore this.
Okay.
This surface. So, and that's why people who have a lot of inflammation, when they switch to an anti-inflammatory diet, their joints start to feel better because they're working against this inflammatory change. Because this STIR image brings out inflammation. Because if you look at a different type of image, for example, this is called a proton density image. Your inflammation is significant enough to see on that, but
oh wow.
But I have patients where this looks completely normal, and you have to have that STIR image to see it. Here's a another cross section of both hips. So, so here's the ball. Here's the ball. This is the left one. Um, and here, even the socket doesn't look too bad because it's not a stir. This is called a T1 image, which is one of the standard images. So what we have here is a degenerative osteoarthritis, which means you're eating away at the cartilage and the surfaces because the bone cells that make cartilage, chondrocytes, are just not able to do their job. And yes, typically you'd be offered a hip replacement at this point. There's too little cartilage for a repair, I think, at this point. Yeah. Is that what they told you also?
That's what he told me, yeah.
Yeah, I think that's fair. But the alternative to try and stave off hip replacement is to improve the health of this bone with an injection or injections, I might want to cover this whole area, of regenerative biologics. And this follows, the French protocol. They have over 15-year follow-up in knees. Their study was on knees. I extrapolated to other joints, where we reinvigorate this area. There was just a brand new study I just read about the importance of it echoed what we know now, the importance of the bone health to the joint status, the proteins and the cells in the bone. So the good old-fashioned injection of stem cells in the joint might help, but those tissues, those biologics have to get into the bone. They have to migrate. It's easier to deliver them right where they're needed. This was proven by the French study in the knees, that the bone injection is superior, both in results and how long it lasted. They had over 82% of patients with lasting over 15 years. We're just waiting for the 20-year follow-up. And these were patients that needed a knee replacement who were able to overcome that need for over 15 years. So that's remarkable.
Which is a hip replacement, or I don't know how long a knee replacement lasts, but don't hip replacements last like 15 years?
Yeah, I mean, the newer devices, maybe a little longer.
Okay.
Of course, it depends on how much stress you have on them. And you're active, you like to go running on wet days when
Not anymore. I don't run anymore. Now I box instead, but
I mean, it'd be great if we can get you back to running. So it's something worth trying. We love to offer this to people. You'd be a great candidate. I would want to put, 1 or 2 doses along this acetabular area and, bathe the area. And I might put a dose right in here also. Even though this doesn't look bad, the cells in here will help support the cartilage surface and here as well. So because you need it, I would do it. But so it comes down to dosing and targeting, and I do all my targeting on the MRI. I measure the depths, and then this is all done at one. It's one and done.
Wow. So then what is the experience like? So you said you'd go directly into the bone. I would imagine that's probably more painful. I don't know.
It would be if we did it awake, but we do sedate people with the twilight sedation. It's not general anesthesia. It's just
is that like the wisdom teeth one?
It's similar, yeah.
Okay.
Similar to that. So you get an IV, you get some oxygen in your nose, and then you're not under general. It's called conscious sedation, but you don't know, you won't feel it. You'll be sore for a week or so, but there's no downtime. You can walk, you can do whatever.
A lot easier than a hip replacement.
Hip replacement's got a little downtime with it. Yeah, fair. Yeah. I mean, listen, a lot of the good replacement guys want to get you up quick and get you moving and get you going. And that's important too. But
so what was interesting when I had this MRI, the lady that conducted the MRI actually had a hip replacement. So she gave me the whole lowdown on it while she was getting me set up for this thing. She was back to work in 2 months. She was up walking the next day. Like, she had everything.
Listen, hip replacements are a thing that can help people, and they have a good record. There's nothing wrong with it, except you got to go through a big surgery and recovery. And you're right. You're a young guy. 20 years from now, you may need to revise it, replace it, if we can help people avoid that with an injection procedure, I think that's a benefit. I think that's good. I mean, I believe it's good.
Yeah.
Um,
So
so it's
what would a day be like for if I were to come in and do this? Would that be in and out in an hour? Well, like what's the timelines? And I know
Yeah,
the
I mean, like
Twilight has a little.
we do these at a little injection facility. So you come in, we talk, make sure you don't have any last minute questions. We go into the procedure room. You drift off into la la land of twilight sedation. The procedure itself might take me 15-20 minutes.
Oh wow.
And then within the next 15-20 minutes, you're in the recovery room waking up. And usually we have you sit around and eat something, drink something, and then you can go. So you might be in the center 2.5 hours, just top to
Oh wow.
bottom. But most people come out, they spend a few days, and I like when you stay overnight, just in case you need access to me and all that
Of course.
afterwards. People come in beforehand. We have a lot of people fly in and, make a weekend of it. Why not? You're here.
Yeah, if you're gonna
And
be.
if you're coming to Las Vegas, great restaurants, great shows. Some people like to throw some dice, whatever. Support the local economy. So
I only do the like cheap slot machines because one time when I couldn't afford it, I blew $100 on roulette in about 10 seconds.
it can go fast. Yeah.
It
So
was really
gamble
fast.
responsibly, but come have some fun. You don't have to gamble. I know we're known for that, but you certainly don't have to gamble. Just there's a lot to do here. It's a food town if you like that. So, but you're from Chicago. That's a food town. You have great restaurants there too.
We do. I think we have the best restaurants, but I'm biased.
Some very good places. We can't get pizza like you can get. That's for sure.
Oh, that is
And
true.
fish.
Nowhere
Yeah.
in the country can, especially New York. And I will crap on New York's pizza any chance I get.
Well, it's very different, right? I mean, New York pizza is very thin, and it's different. It's just different. So anyway, you'd be a good. Listen, it's something to try before replacement,
Yeah.
because if it makes you 80% better and you're content and happy and you can push off the replacement 5, 10, 20, 15 years, or maybe by then I have this procedure even down better, like we've enhanced it so you can repeat it. I think that's good because, everything improves, technology improves. So,
Right.
yeah.
Well, yeah, this is great. I definitely would rather do this than go through a hip replacement. So I think I'm sold. But
Well, and just to be upfront with you, as I would with anyone, I can't make any marketing claims because the FDA has not approved my marketing claims that I can cure or treat you. I can show you the literature I'm referencing. I can introduce you to people I've treated, and they can talk to you. I can show you those stories, but I don't want to be non-compliant in any way. But that doesn't mean we can't do this, and have a thorough discussion about it and offer it to you.
yeah. Well, I thank you so much for taking the time to do this. And I know it's probably a little weird, but yeah, I mean, once you're on reality TV, showing your hip MRI to the world doesn't really seem like it's that big of a deal. They know just about everything anyway. So thanks for doing this. This was really cool. And
Of course. I
yeah.
enjoy it. If anyone has any questions.
Yeah, totally. Yeah, I'll take questions if anyone wants to DM me or put them in the comments. I watch that stuff. So that would be great.
Awesome.
All right. Well, thanks again. This was fun, different, and exciting.
I'm glad. Okay, you're welcome. Take care.
Thanks. And just like that, a few short weeks later, I'm arriving in Las Vegas to have Dr. Gross perform the stem cell procedure on my injured hip. I wasn't nervous about anything and felt like he was very thorough in laying out the process and the expectations. The only thing I was nervous about was how much pain I would actually be in post-procedure, and we will get to that. But it was a quick trip. I arrived on Tuesday afternoon, walked around the strip a little bit, grabbed some food, hit the sack early, at least Vegas time. I couldn't eat or drink anything prior to the procedure, which was in the afternoon, so that was a little challenging. But before I knew it, it was procedure time. Hey everybody, come with me today as I'm going to get my hip injections with Dr. Jeff. And the whole procedure takes about 15 minutes. However, they said to expect to be here for about 90 minutes total. So let's get to it. So I got all my paperwork filled out, changed into a gown, blood pressure check, everything's good to go. Now we're just waiting for the doc, and we'll be off to the races. You know how it is with doctors. They have no problem leaving you waiting for however long they feel like it. That wasn't really the case here. It just felt a lot longer than it was as you're sitting there waiting to be wheeled in for your procedure. But everyone was really nice. A whole bunch of people waved or came by to say hi, and it was a genuinely very positive experience. And once Dr. Gross came, it was time to review the procedure one final time.
It's procedure day.
Happy procedure day.
So no surgery, we call it procedure day because we're trying to avoid surgery. But let's review what we're going to do. Right, we've gone over this. I've examined you in the office. We've looked at your MRI. We've correlated the tears and the degeneration in your hip joint, and we're trying to avoid the surgery you were recommended, which was
Total hip replacement.
You feel a little young for that?
Yeah, I'm only 39. I don't think a total hip replacement is in the cards right now.
So the problem is, and I noticed this when I was doing spine work, of course, the menu drops from appetizer to dessert, meaning it goes from, oh, well, we could clean up a little tear, all the way, it jumps down to replacement. And I'm trying to help fill in between something less than a replacement, because your original equipment, unless it's too far gone, is the best equipment. So remember, your stem cells created that hip when you were a fetus, when you were a baby, when you were a kid growing, and until you stopped growing that, and then it maintained it until it got too injured beyond being able to be maintained. So we seek to reinvigorate the cells in your bone marrow, a lot of stem cells, to reactivate the original factory, to put in a new order for some more cartilage. And we've seen some amazing results, with return of cartilage thickness, improvement in tears, improvement in pain-free mobility, and so you can return back to your ultra marathons and all the things.
Yeah, so I can start running again.
Yeah, right. Yeah. So that's how it's done. It's done through an injection, but the injection is in the bone, as we discussed, and the reason for that comes from the French studies of over 15-year follow-up, showing the bone injections just at the edge of the cartilage, right up against there, is beneficial longer and more so than injecting the cartilage itself. Because think about cartilage, it's kind of biological rubber. There are a couple cells in it, but it's really just the protein that's made by those cells. In this case, cartilage proteins, aminoglycans and things like that are squishy, and we want them to fill with water and be a cushion. So we're looking to restore that by stimulating those cells, and that's done using the youthful biologics derived from stem cells called stem cell-derived extracellular vesicles, or for short, exosomes. And they come from youthful donors, youthful meaning mothers who are having C-sections, right. and when they're done with their amniotic fluid, we take it. It goes through compliant and sterile lab processes. It's tested, screened, and sent to us. And it's a high quality, high protein product that is known to stimulate more anti-inflammatory and youthful cell processes, the way our cells work when we were young. Right.
Yeah, like a man-made.
So we've been very excited by the results in the spine and the joints. Of course, we use them for other purposes, but in your case, we've already done the targeting.
Yep.
And we're going to hit both the ball and the socket, the femoral head and the acetabulum for those anatomy nerds at home, and also a little bit on the greater trochanter because you have some tender and inflamed tendinous insertions of the muscle, the gluteus muscle there. So we're going to hit all those areas, suppress inflammation, and then hopefully you feel some improvement from the anti-inflammatory effect. But this will take months to do the regeneration, and we monitor that by how you feel and what you can do. No downtime. I want you to be up on this hip this afternoon.
And I'm in Vegas, so there's plenty to walk around and do.
It's a good time of year for some good walking, get your steps in. The Las Vegas Strip is it looks like, oh, that next casino is just a block away, but it can be like 3/4 of a mile, right? So it's deceptive. Is the word I was
exactly.
Yeah.
I was like, I'm at the Aria and I looked. I'm like, I'm gonna go walk to the Mandalay Bay.
Yeah, it's crazy.
45 minutes later. So this is pretty quick.
Yep.
We go in. I get what type of anesthesia? I always forget.
It's not general. It's called twilight or sedation. So it's just a little IV sedation, some oxygen in your nose, and this is the easy part. The hard part is confirming the source of the pain, matching it up with a target, doing the MRI, doing the exam, putting it all together. Today is just kind of the icing on the cake.
Right. And it's a pretty quick procedure once you're in there.
I mean, it should take me 10 or 15 minutes of my time. I'll give the anesthesiologist 5 or 10 minutes at the front end, 5 or 10 minutes on the back end. So you might be in the room for half an hour.
Okay. Yeah. Very quick.
Yep.
Very quick. And then no real downtime, but
no, I want you on it.
Yeah, and some soreness, but otherwise on it.
Yeah, and soreness, you'll use ice and Tylenol. We want to avoid anti-inflammatories, certainly avoid steroids, because they negatively impact the biologic process of the anti-inflammatory benefits at the cellular level. So we don't want to stop one pathway artificially with a pharmaceutical.
Got it. Yeah. Right. That sounds good.
Yeah.
Good.
Any questions? Anything else you want to
I've asked about every question throughout this whole process I could ask.
I'm here to explain it, and as you know, risks of any needle can cause infection, bleeding, pain in the site. We're going to mitigate that with some numbing agent at the area. And some people feel great right away, and 6 hours later when that wears off, they go, whoa, something's happening wrong. Not necessarily, it's just wearing off. So stay ahead of it on the ice. You can use Tylenol if you need it. It will be sore, but you're getting on a plane tomorrow to go back. Yep. Just, stay ahead of it.
I have an aisle seat, so I can stick my leg out.
Stick your leg out, get up and walk around on the plane and keep moving, because regardless of this procedure or not, we don't want anyone to get a blood clot from sitting on an airplane, which is a risk factor. So, so move around, don't cross your legs, on the airplane, stuff like that.
I couldn't if I wanted to. My legs are long.
And there you go. And that's the procedure. And we've got a few of those today. And
awesome.
We try to do these 1 or 2 days a month, just group them and do them. Most people, like you and the other folks today, are all from out of town. So
yeah, okay.
Yeah.
Lots of people are learning about these processes to try and kind of elongate their youthfulness.
Yes. So both you and my next patient too also is trying to avoid a joint replacement surgery. Yeah. It's a knee in that case. But,
okay.
Yeah.
Yep. Awesome.
All right. Let's do it.
Let's do it. I've never had surgery before, and I wasn't exactly sure how the twilight anesthesia was going to work or how it was going to feel. Once I was wheeled in, everything was getting set up for my procedure, and I assumed I would naturally get a little drowsy and maybe doze off, but that's not how I remember it at all. They asked me if I had any music preference, to which I responded with anything but country, which, on a side note, I get a lot of shit for, but I'm confident enough to say country music is not my thing. But for all I know, country music was all they played, because I don't remember anything after answering that question. The next thing I'm aware of happening is the staff sliding my dead weight onto the gurney to wheel me back into recovery. By the time I got back to recovery, I started getting my bearings back, but I was still a little out of it. It's kind of like that feeling you get when your alarm goes off and you need to get it together enough to turn over and hit the snooze button. But Dr. Gross came over and had me lift each leg one time and asked how it felt. It felt great aside from some minor tightness in my injured side. It was more so like a soreness, like maybe I had gone on a long run the day before and was feeling a little bit tight. But Dr. Gross briefed me on how the procedure went better than expected, and he was able to inject treatments into more parts of the joint than he had originally planned, which should improve the results. After a few more minutes, the rest of the twilight anesthesia wore off and I was ready to get back to my hotel. My post-procedure protocol was to walk as much as I possibly could for the rest of the evening. As Dr. Gross said, the procedure was injections, nothing structural was modified, so movement is key to kickstarting the recovery period. Turns out, though, I wasn't going to be moving much until I was back in Chicago. I just got back from Chicago, and my post-procedure experience was very, very painful. I was excited to walk around the strip, document everything, but the reality is by the time I got back to the hotel, the local numbing had worn off, and I was in a lot of pain. My hip felt like it was on fire. It kind of still does. It feels like my hip flexors, although it's a little bit better today. I feel like my hip flexors are just ripped, just shredded, completely shredded. And every step I tried to take felt like it was going to be the last one that I could take yesterday. So I just got food on the way to the hotel where my Uber dropped me off. It took me almost a freaking hour to get up into my hotel room, and I have to tell you, like, I was this close to crying because it hurt so bad. I was taking breaks, stop sitting down at slot machines. I was just stopping and standing in the middle of the aisle because it was so difficult to just lift my left leg to move. I honestly wasn't even sure I was going to make it home, but when I woke up this morning, it was a little more tolerable. But yeah, I went into my room last night. I laid in bed. I was just laying there, kind of waiting for the time I absolutely had to get up to go to the bathroom. But by the time I got to the airport earlier today, flew back home here to Chicago, I'm feeling light years better. My hip is, it's still feeling very heavy. Hip flexors, like I said, totally torched. Dr. Gross said that it would take a few days for the soreness to pass, but yesterday and even this morning, really, it was almost unbearable. But now I'm feeling a little bit confident that it is healing, and that maybe it was just from the procedure itself. I mean, you got to go through the muscles to get to the hip. That's one of the things that I was concerned about, how much pain it would be. But I'm feeling like in a few days I'll be back to my baseline at the very least, and give this treatment an opportunity to do its work. It takes several months, 6 months, maybe 8 months, maybe longer. So I will just keep monitoring it and checking in with Dr. Gross. I have my 1 week follow-up next week with Dr. Gross, and then after that we'll do every few months a check-in. So I am home. I am feeling-ish better, but man, let me tell you, the hip flexor and the pain once that anesthesia wore off, the local anesthesia wore off, whew, that was something fierce, and I'm glad that it only lasted, at least in that unbearable way, it only lasted last night and a little bit this morning. So I guess it's on to that 1 week follow-up, and hopefully I'll be better by then. This is our 1 week post procedure follow-up appointment. So I have Dr. Jeff Gross here again to talk about what happens now from here.
Great. All right. Well, we just jumped on here, so I haven't had a chance to ask you how your week went, how the soreness is. Hopefully it's falling off, how you're moving along. So why don't you give me an update, and everyone can just listen in.
Yeah. So the first day, once I left the office, I felt pretty good. And then all of a sudden I didn't. I think it was because maybe some stuff wore off. But the first day was really, really painful. Probably some of it felt, so I had like my normal hip pain, but then on top of it, like the front of my hip, I would say my hip flexors did not have any strength in them whatsoever. They were sore, like I had just run for 10 miles or something, and no stretching. So like that first day, I had a hard time walking. I had a hard time sleeping. And then the next day, so I didn't move as much as I wanted to that first day. But the second day I woke up, and once I got moving, I started feeling a little bit better, and I was able to walk myself to get some lunch, walk myself to the airport. Sitting on the plane wasn't ideal, but I moved around like you suggested and walked up and down the aisle and went to the bathroom a few times to just have reason to move. And then by Friday, I was sore, like not fine, but I was like able to start functioning again, like go for a walk, and I could keep walking and not have to take a break or keep it short. So I would say by Saturday, it felt like I was a little sore from working out. Still, the hip pain is similar at the time, but then by Sunday I didn't feel it really at all anymore, and all the muscle soreness was mostly gone. I would say it feels the injection sites feel a little like a bruise, but only if I push on them.
Okay, and that's typical. The kind of path you just told me about. Usually by the end of the first week, people say, "Well, I have my usual joint symptoms." That the reason why we did the procedure, but the procedural, pain is brief. and I can
Hmm.
walk. Now, can you go? Have you been back to the gym? Can you do your exercises? Where are we now? Here
Yes.
we are. By
So
the way, today, just in case this is broadcast at some future date, it is it's a Wednesday, and we did this a week ago, right?
yeah, it's
Okay,
exactly
all
one
right,
week later. Yeah, yeah.
okay.
So I've heard you asked me something and I
I was
forgot what
asking
you
you,
were
have you
asking.
been able to exercise, go to the
Oh
gym,
yeah.
that kind of thing? Yeah.
So Friday when I was back home, I did some weightlifting, upper body only, so standing and sitting on my weight bench. And then Monday, I box 2 to 3 times a week. I try to go three, but it's sometimes just two.
Hmm.
And then I weight train as well. So this week, starting Monday, I did my first boxing class again, which was again sore, but no more sore than really normal. And then I'm going to be going again tonight to my boxing class. And then I weight lifted like
Okay.
normal yesterday. So I'm back to exercising like normal.
Okay. Good. Very good. Very good. Now, it's common for us since I did use a needle on you. I had to ask you about your wound. Any problems with the wound site? Is the Band-Aid gone?
Yeah, the band-aids were gone Friday. I think I took them off.
Okay.
And whatever band-aids you use, super waterproof. I was impressed.
I, I, I can't tell you we use anything special, but
Okay.
I'm glad it lasted. And then, uh, and we always ask any fevers or chills or signs of infection of any kind, drainage, pus.
No, not at all.
Okay.
Just a little red and feels like a bruise.
Okay. Good. And that should continue to improve, right? That's just the pain of having to get in there.
Hmm.
So that's all good. Now the slow part, watching the paint dry, watching the magic happen. Some people have an early anti-inflammatory reduction in pain. The component of pain that is because of the inflammatory peptides and proteins your cells are dealing with. So some people have some early benefit. You might start to feel that. You might not. Um, and that can sometimes last weeks or even months. And during that time, we're waiting for the actual regenerative component to happen, whereby those cells that we stimulated start to do what they did better, what they used to do when they were younger, and do that better. Make collagen, make the other proteins that constitute cartilage. Produce it. So that takes time.
Hmm. Right. And I think from the anti-inflammatory, it's hard because you know this because we've talked about it so much, but like sometimes it is fine for a few days and I barely feel it there. And then
Yeah.
other days it's very painful. I haven't had like the general hip pain of when it's painful in 3 or 4 days. So that could be maybe even longer. I really haven't felt the like regular hip pain in 3 or 4 days, I'd say. So it
So
could be the anti-inflammatory piece of it.
let's explore that a little bit. How many times a month on average? How many days per month would you have some of that? And let's, for all intents and purposes, call it the inflammatory hip pain.
Okay. I would say it would depend, of course, and I couldn't ever. Sometimes I would try to like track if am I doing too much walking, too much physical activity that it flares up. But it would be probably like 5, 6 days a week. I would have pain at least at some point in the day. Another thing I've noticed is when I would sit on my couch for TV or a movie or something, I would get uncomfortable at some point and have to move a lot. Um, and so I've noticed that last night, which was really the first night that I like watched TV since then,
Mm-hmm.
for more than a little bit, like I didn't have that pain pop up from sitting in one space too long.
So this is good, and this is why we talk and ask these questions, because people say, "Oh, you made me
Yeah.
think about that." I hadn't, it didn't come across my mind until just then. So that's really good. So those are some early observations, and I think you're right. These are the early suppression of inflammatory proteins and peptides and cytokines and fancy words that cause part of pain, right?
Yeah.
These are
Yeah.
these are the things that a cortisone shot works on, but a cortisone shot does not have any regenerative properties. In fact, it can accelerate degeneration.
Mm.
So here we're addressing the inflammation in the right biological direction, the correct,
Right.
the restorative one.
Right. And I've
That's
done
great.
cortisone shots, as you know, and they last for a
Yeah.
little bit. And then when they
Yeah.
don't anymore, you're in worse shape than you were.
Potentially, yeah. So, well, this is all par for the course. It's good news. No complications, no issues, no problems. And now we think good thoughts and let your nature do the job. Let your cells do the job.
Yeah. And then for people who are listening and watching, just for the sake of a quick hit, like what happens at 3 months? What happens at 6 months? Like, what are some of the things that I should be paying attention to, or someone who's had this procedure be paying attention to?
Uh, you probably won't need to pay attention to anything that you're not already paying attention to. Like, and it'll be one of those look backs 3 months from now when we talk. You're like, yeah, you're right. I haven't had much of that. I can do this without getting flared up. Like that's what I'm hoping for, right?
Yeah.
It's not something you'll measure on a day to day basis, like getting on and off a scale on a diet. So, and the real goal is to continue to show a progressive decline in symptoms, decline in the episodes of the more flared up pain, uh, decline in the discomfort in certain positions to the even when you do provoke it and use it in the gym strenuously and what have you, to the point where you're like it's not bugging you much at all, if that.
Hmm.
So that could take 6 months or more. Hips take a little longer than knees, for example. And I think that's due to the ball and socket
Right. Right.
structure and surfaces and weight bearing and that kind of thing. So, but weight bearing is good. The exercise is good. It stimulates the biologic processes we want, the mechanoreceptors. We want you to do anything else you can to support this. So you already have a really good diet and exercise and sleep hygiene and protein intake is important because you're making proteins, so you need to take in proteins.
Hmm.
We could talk about adding peptides if you want to get fancier to enhance it. People do the Wolverine protocol we may have spoken about
We
previously.
didn't. What's the Wolverine protocol?
So in the field of peptides, there are three peptides that, when used together, are really supposed to support healing, and that's called BPC 157, which is body protection compound 157, which is a small protein fragment called a peptide that's common in many of those processes of healing. The other one is called TB500, and the third one is called the copper peptide, or
Hmm.
GHKCU. And these can be injected. The copper one can also be taken topically or intranasal or even orally, I think.
I
Uh,
actually take that on my hair. I have a
yeah, so
copper
that's really
peptide
great
that
for
I
hair
do on
growth.
my hair. Yeah.
Do you notice a difference?
It's been about 3 months. What I've noticed is my hair is a little bit softer when it's not hairsprayed, but
Yeah.
that's kind of where I've noticed it.
You haven't noticed increased growth.
No, not yet. Not after 3 months.
Okay. Um, Hair growth is challenging, right? It
Yeah.
takes more than one thing usually. So these things can be used to enhance the healing. A lot of the pro athletes are using these things. Certain quarterbacks, maybe with an ankle injury, may have been using them, that might or might not play for the Jets at one point. Things like that. So they're
Who's
out
probably
there.
not playing for the Jets much longer.
so So those things can be added if you want to get fancier. These are things we can't prescribe, but I can show you what websites to get them, and you buy them online. And
Okay.
so some people use them just for health, but they are supportive of healing. There are many peptides we're discovering more all the time now,
Yeah.
um, so it's cool.
That's cool. Yeah. I would love to look into that a little bit more. I think I'd be
Okay,
curious to learn about
yep,
that.
for sure.
Cool. So what happens next now? I know we meet,
Yeah,
how often and for
we'll
how
probably do
long?
about a month from now. Of course, I'm always available if something comes up and there are questions, and we can
Hmm.
record those as well. Even if it's you have a downturn or something. And in medicine, we want this improvement over time. But
Hmm.
if you look close at that graph, it's really little ups and downs. So you'll have good days, bad days, that kind of thing. That's normal, as long as the big picture overall is moving in the right
Like the
direction.
zoom out. I call that the zoom out. When
The
you
zoom
zoom
out,
out, you
yeah,
want to see the up.
30,000 foot view. That's what you need
There
here.
it is. Exactly. Well, that's great. And again, this has been, I've learned, I hope that everybody who's watching, I hope you're watching and you came over to YouTube to watch. But if you're just listening still, this has been a journey that you've all come on with me. We've learned at the same time what this whole experience is like. And we'll keep making sure we have those updates. Been a few weeks since I last met with Dr. Gross right before the holidays, but I'm scheduled for my 12-week post-procedure follow-up, I think in like 2 weeks, in middle of February. So I guess that's more like 3 weeks, depending on when you're listening. But I'm roughly 8 weeks through the treatment now, and there have definitely been some things that I've noticed are different or seem to be improving. Um, I still have rough times. Like I used to have rough days with my hip, but I have rough times. So there may be a couple hours where it's bothering me. And I don't really think it's fair to say it's bothering me as bad as it was pre-procedure, but there are still days where it bothers me and I can feel it there. I can feel something's not right. There's a pinching, there's a throbbing pain, something like that. But I've noticed a few little areas that have been better. One is that those painful times don't last as long, at least not as of right now. And then the other thing that I noticed is there's times when I'll be sitting maybe on my side or I'll be favoring, how I'm sitting on the couch or something like that, which would usually be very painful after a few minutes. And then I'd have to move or get up or just be uncomfortable. And I've noticed that those times when I'm maybe favoring it or sitting on it a certain way, those seem to be less and less frequent. Another thing that I've noticed is that my range of motion seems to be improving when I do squats, for example, or when I do I box. So when I do boxing classes, like I seem to have more range of motion in my hip before I start to feel a pain there. As you learn through this whole experience with me, it can take 6, 8, sometimes even longer number of months for the rejuvenation to fully reach its peak. And I definitely think too that there's been some reduction in inflammation. Like I can just almost kind of feel it doesn't feel as inflamed as it was before. And then I think the last thing that I've really noticed, really in like the last couple of weeks, is I actually have very little pain. When I do have pain, I have very little pain sort of on the bottom of the hip joint, which is where it would sometimes go to, as I've said. But I kind of feel almost as if overall it's definitely improving. I'm hoping for more improvement. It's definitely better than it was. I definitely feel, again, like a better range of motion. The painful parts of it are less frequent. I think that this is ultimately going to be something that, as Dr. Gross has said, like you slowly start to notice little things that maybe may have been different without this procedure. And it isn't just a snap of the finger and everything's fine. So I have my follow-up again in a few weeks. I will look forward to keeping people updated on this. I've received several DMs, which I'm grateful for, people as well. So be sure to follow along to hear any other updates. I am overall very positive and excited about the progress I've made so far. I am all about recommending people, talk to your doctor about these opportunities if you have them, or alternative treatments, because, if I can rejuvenate enough of my hip injury to even postpone a hip replacement to hopefully like years down the line, if at all, there's plenty of other opportunities, I think, where people can really kind of learn these alternative options, dig into them, and then find a doctor that's going to support you in your overall healing journey instead of, slinging hip replacements or joint replacements or whatever else gets thrown out there with your doctor. So I want to thank you guys. If you're listening to this still, or you watched this hopefully on YouTube, I hope you enjoyed it. I hope you found it helpful. I hope it helps you feel like these alternative treatments like stem cell therapy is available to you, and it is out there, and there are doctors and studies and all of these things going around, these rejuvenation type therapies that could really help push us into a more modern and holistic wellness of our body. So I want to thank again Dr. Gross for allowing me to capture all of this. He's been a wonderful doctor, and this experience has been really remarkable. And I trust the process, and that's what I think we all need to do. We've just got to make sure that we're in the right process. So hope you enjoyed this episode. We'll be back next week with an all new episode. And I hope that this helps you look at stem cell treatments in a new light. So thank you. Thank you for joining us on this week's episode of Eyes Wide Open. If you enjoy the show, the best way to support us is by sharing or dropping a review. For more information and content, check out engagewithnick.com or find me on Instagram at nthompson513. Don't go through life blind. Do the work so you can show up in the world with your eyes wide open.